Do you really know what a heart attack feels like? Most people imagine a sudden, traumatic scene, a man clutching his chest, gasping for air, collapsing to the floor. But the truth is far more complicated. A heart attack doesn't always announce itself with pain or panic. Sometimes it whispers. Sometimes it hides in plain sight. Every year, millions of people suffer heart attacks, and too many of them never realize what's happening until it's too late. When I first learned this, I realized how easily we mistake the signs, how we dismiss the early warnings because we think it's nothing serious. But the heart has its own language, and if we learn to listen, we can save lives, including our own. Today, we're diving into heart attack symptoms, one of the world's leading causes of death. According to the American Heart Association's 2025 guideline, heart attacks or acute coronary syndromes remain the #1 killer of both men and women around the world. Every 40 seconds, someone in the United States has a heart attack. That means that by the time you finish watching this video, several people will have experienced one. Some will make it, some won't. And the difference often comes down to awareness. It's not just a medical crisis, it's an awareness crisis. The Centers for Disease Control and Prevention estimates that cardiovascular disease costs more than $300 billion each year. Not just in hospital bills or medications, but in lost moments. Birthdays, graduations, the sound of laughter that suddenly goes quiet. Behind every statistic is a family, a story, and a silence that came too soon. So today, let's break that silence. When people hear heart attack, they usually think of crushing chest pain, a heavy pressure that radiates down the left arm. But according to the 2021 AHA-ACC chest pain guideline, that image doesn't tell the whole story. The reality is more complex. Sometimes the heart doesn't scream, it whispers through subtle, quiet symptoms. A silent heart attack can feel like mild fatigue, discomfort in the shoulders or neck, or a sense of indigestion that lingers longer than usual. You might feel a heaviness after climbing stairs, or an ache that comes and goes, and you brush it off as stress, bad sleep, or maybe too much caffeine. What's really happening inside your body is that the arteries feeding your heart are narrowing. Over time, plaque, a mix of fat, cholesterol, and calcium, builds up along the artery walls. When one of these plaques ruptures, it blocks blood flow, starving your heart muscle of oxygen. Within minutes, cells begin to die. But because the nerves that sense pain vary among people, not everyone feels the same kind of warning. Some experience classic chest pain. Others feel only a deep, unexplainable tiredness. In fact, research shows that nearly 1 in 5 heart attacks are silent, meaning people don't even realize they've had one until weeks or months later. Often, it's only discovered during a routine ECG or a medical checkup. By then, the damage has already been done. That's why understanding the symptoms of heart attack isn't just about recognizing pain. It's about decoding the small, silent changes your body sends before it's too late. Now, here's something many people still don't realize. Heart attack symptoms can look completely different in women. The 2025 ACC-AHA guideline for acute coronary syndromes emphasizes that women often experience what are called non-classic or atypical signs, though the new guidelines actually discourage the word atypical because these signs are not rare. They're just different. Women are more likely to report fatigue that lasts for days, lightheadedness, nausea, or a feeling of pressure in the upper back, neck, or jaw. Sometimes it's shortness of breath that comes on suddenly. Other times it's pain between the shoulder blades or in the upper abdomen that feels like acid reflux. These are all possible signs of a heart attack in women. That's why the keyword heart attack in women has become such a critical public health focus. According to the AHA's Go Red for Women campaign, women are more likely to misinterpret their symptoms and delay seeking help. They often assume they're just overworked, dehydrated, or dealing with anxiety. But studies showed that women who wait more than an hour after symptom onset have nearly double the risk of death compared to those who seek immediate care.
Ischemia can
Imagine
lead to
this,
significant
a
tissue
45-year-old woman feels tired, dizzy, and nauseous for 2 days. She thinks she's coming down with the flu. She pushes through work, cooks dinner, and goes to bed early. The next morning, she collapses in the kitchen. The diagnosis? Myocardial infarction, a heart attack that had been building for days. These stories are far too common. The lesson? Don't wait for pain in your chest to take action. Sometimes your heart cries for help through your back, your stomach, or your breath. The next big question is, why does this happen? What causes these attacks in the first place? According to the CDC's best practices for cardiovascular disease prevention, most heart attacks can be traced back to things we can control. Lifestyle factors, high blood pressure, high cholesterol, smoking, poor diet, inactivity, stress, and uncontrolled diabetes all slowly weaken the arteries that feed your heart. The good news is that you have more control than you think. There's even a simple online tool called the Heart Attack Risk Calculator that helps estimate your likelihood of having a heart attack in the next 10 years. It's based on your age, blood pressure, cholesterol, and lifestyle. But beyond statistics, what truly matters are the small choices you make every day. The diet for heart health isn't about restriction, it's about fuel. Think Mediterranean, colorful vegetables, whole grains, olive oil, salmon, avocado, and nuts. Think less about avoiding food and more about feeding your heart the strength it deserves. Exercise is another key. Just 30 minutes of brisk walking a day can lower your risk by nearly 30%. Pair that with 7 hours of quality sleep, regular blood pressure checks, and avoiding tobacco, and you've already built a powerful shield against heart disease. Stress management matters too. When you're under chronic stress, your body releases hormones that increase blood pressure and inflammation. Over time, that invisible tension takes a real toll on your heart. The heart remembers every sleepless night, every cigarette, every skipped meal. And one day, it may remind you in the most painful way possible unless you start listening now. Knowing this, these hidden heart attack symptoms, is the first step in your transformation. Because the truth is, prevention doesn't start in a hospital. It starts in your home, in your habits, and in your awareness. You don't have to be a doctor to save your own life. You just have to listen, really listen, when your body whispers. The 2025 guidelines call this early recognition and response. If something doesn't feel right, pressure in your chest, exhaustion that doesn't fade, sudden shortness of breath, don't wait it out. Call emergency services immediately. Every minute lost means more heart muscle at risk. And if someone near you collapses or shows signs of a heart attack, remember this simple rule of first aid for heart attack. Call first, then care. Call for emergency help. If the person is unresponsive and not breathing, start CPR right away. If an AED, an automated external defibrillator, is available, use it as soon as possible. These actions can double, even triple, the chance of survival. The heart doesn't ask for perfection. It asks for consistency in what you eat, how you move, and how you care for yourself. Because heart attack prevention isn't about fear. It's about empowerment. It's about turning awareness into strength and knowledge into action. If this message touched you, share it. You never know. One share could save a life. Subscribe to the Cardiac Hub, where knowledge meets action and awareness turns into strength. Because when your heart speaks, it's worth listening.